Hello everyone, welcome back to my channel. So in this lecture, we are going to study about the lower GIT bleeding. We have already studied in the previous lectures how we can distinguish between the lower GIT bleeding and the upper GIT bleeding. So we can distinguish basis of the ligaments of troids. So the symptoms of lower GIT bleedings can be present as dark bloods, clots in feces or in diarrhea, hematochezia, which is also known as bloody stool, most commonly seen in lower GIT bleeding. The causes of lower GIT bleeding can be severe acute, subacute, or chronic. In severe acute cases, we can see in diverticula, which is the most common cause of this lower GIT bleedings, and it can be spontaneously resolved. And if not, we can do surgical resection. Second cause is angiodysplasia, which is most commonly seen in elderly people, and it can also be spontaneously resolved. If not, we can do surgical resection. It can also be seen in Meckel's diverticulum. We have already studied about these diseases in previous lectures. And the fourth one is bowel ischemia, which can cause occlusion in inferior mesenteric artery. Second cause is subacutes like hemorrhoids, anal tissue, and they can profusely bleeding. And it is very difficult to manage these conditions. Chronic conditions like occult bleeding. Occult bleeding means we cannot see the bleeding from outside. So it is hidden bleeding. Can be seen in cancer of cecum. Diagnosis can be based on the endoscopy. We can distinguish based on the endoscopy, like it is upper GIT bleeding or lower GIT bleeding. We can do colonoscopy, and in 70% of the cases, cause can be identified based on the colonoscopy. Third is capsule endoscopy, which can identify problem in the small bowel. Fourth is stacked RBC scan and arteriography. Treatment, we have already studied, like it can be spontaneously resolved. If not, we can do, first of all, given initial management. We have studied in the upper GIT bleeding, initial management like resuscitation of the patient. And if the patient is losing so much fluid, so we can give IV access also. Resuscitation includes like a normal saline, ringer lactate. We can do test on the basis of hemoglobin and hematocrit. Hematocrit is the most reliable indicator. So these are the initial management. We can provide initial management. So specific management can be in diverticuli and angiodysplasia, we can do surgical resection. And in bowel ischemia, we will do colonoscopy. And if there is a symptom of peritonitis, so we will do surgical resection. And in the most of the cases, bleeding is unknown. So we will identify based on the CT scan, angiography. So this is lower GIT bleeding. It is a small topic, but important. Thank you.